Hey, Dr. Lindsey and Wendy here. We're going to go through a fellow that's, what is he, 34, 35 now.
33,
I think he says it in the video. That is now 17 months out from us doing his frontal third. So here he is when we first met him, and he's combing that hair forward, and we didn't know it, he's dyeing his hair, right?
Yeah, oh yeah, he mentioned it when he came this last time.
Even though he's a good bit younger than me, he's already getting some gray.
Yes.
Which will only increase now that he's married. Yeah, right?
Oh, that's right. There was the girlfriend, the redheaded girlfriend. Then he got engaged, and he came because he was close by,
right?
Because he's getting married. I think it's next month.
Or did he just get married?
No. He's getting married next month.
Right.
That's why he was letting his hair grow long because he wanted to just like get the haircut before the wedding.
That's correct. Yes. So here he is before, and you can take a look at it's a little bit of reddish hair that's combed down, and then when we're coming back to show the plan, you can see that frontal third doesn't have much hair in it at all.
Yeah.
And then here's the end of the case, and then he came a couple times that week to get for you to clean.
Yes, because his dad lives close by.
And frequent of you viewers will know that I'm a big stickler on cleaning, so I'm going to splice in one of his cleaning videos. I think it's about day 4 right now.
4.
Okay, so now we're day 4. This is a different guy than the other video that I have of cleaning on day 3. This is day 4, but
he's been coming every day.
Good job. Yeah, we got pictures every day, which is free. We encourage people to live locally to come in here because I want it to work as much as you do, or almost as much as you do, and that is perfect. And if you look and see how much Wendy's rubbing, she's got her hands all lathered up, and she's just rubbing on there.
And you can see some of the dead skin comes up.
Yeah, but there's no bleeding, no
there.
hairs are coming out. That looks perfect. And then this is normally just be shower water. It's a bottle of water.
We don't have a shower head.
Yeah. This is day 5. This is we did it on Friday. So we'll do this again tomorrow, and then
we can remove the sutures tomorrow. His incision looks perfect.
Yeah, we can do that. That's fine.
So see those little scabies already like soft in it right there?
Yeah.
You see that?
That's perfect.
So he's gonna put oil. See, they just coming up. They come up. You can't see them. They're dark hair.
Yeah.
It's just dead skin. I told him to put oil tonight, so tomorrow I can do more.
Yeah.
And be done with it.
Okay,
Yeah.
6. It's just underneath holding it together.
Yeah, you'll see his incision. It's really nice.
Okay, perfect. So that's how you clean, right, Nurse Bohorkis?
Yeah, some patients are afraid to scrub a little hard, but if you're looking in the mirror, you can definitely see if you're being a little too aggressive around the incision line. It will have like a little bit of blood, so that's when you need to stop.
So our deal here at this office, and check with your doctor if you're using somebody else, is that we don't want you to really do anything for the first 2 days, and then we want you to start showering and using conditioner and actually rubbing the gradu and dirt that builds up around the base of the grafts. Because if you don't clean, then all this crust builds up, and it actually, the attachment of the crusts to each other in the hair gets stronger than the attachment of the hair into the scalp, and whole swaths of hair will come out. And we've seen that on a few people, and I got another video that shows that. But so I'm really uptight on cleaning. So this is how we clean. And then he came back at, let's see, what is that? 9 months. No, 3 months. We got him at 3 months here, and most of the hair we've put in is fallen out, and he's gotten a little bit of the original hair back. And then here he is at 9 months, looking pretty good. And his scar at 9 months. And then here he is at 17 months compared to where we started. So he looks good. So here's a little video of him. Okay, so I will not get your face. How old are you? I can't remember.
33.
And so we did you about 17 months ago, I believe.
That's right.
And you're getting married in 2.5 months, which means your life is coming to an end now that we got you a good head of hair. And that looks good. We do a lot of fine haired videos, and this is a good normal hair.
Yes.
And your dad, I remember your dad, he was a really cool guy. He had, I think, didn't he have a hair transplant at some point in the past?
1967.
Yeah. That's pretty good. When you pull on that hair, does your girlfriend pull on that hair? Or your fiance?
All the time.
All right, turn around and face the wall. And look up at the ceiling one time. Yeah, that's pretty good, man. All right, now lean back down or straight ahead so I can see your scar. And you're like me, you got a little bit of psoriasis. That's a pretty good scar, though. Let me put my hand there so you can focus on it. That's a pretty good little scar. Any problems?
Never.
Happy with it?
Very.
Any? You can turn back around. I don't have your face. Any advice you think anybody looking at this video ought to know?
6 hours of pain for a lifetime of good hair. Easy to do.
Was it that painful?
Nah.
All right, thanks a lot. So what do you think, Wendy? It's good. His dad had some plugs back in the 80s,
Yes.
and his dad was really cool. I was trying to
Yeah,
talk
his
to him
dad
about
was
that,
like,
repair
he was
this.
so surprised the way that we do hair transplant now.
Yeah.
He said he was younger, he would have it done.
Yeah.
And he doesn't care now. So.
Yeah, that's all right.
Yeah. But yeah, he was very, he was surprised. He loved the whole procedure.
Right.
Yeah.
And as you saw, I couldn't use his face because he has an important job. But I really appreciate him coming in and showing his results. And with his dad being as bald as he is, we'll probably see him at some point in the next 9 or 10 years.
Yes. He did have this hair transplant preparing for the wedding too.
Yeah. Well, if we can help you, please give us a call. Thank you.